Good morning, everyone. How are you? Today is the Friday, and today is the 13th of September. I thought I'll give you a quick video to explain some facts about the fibromyalgia. Of course, I spoke to you in the last two videos about fibromyalgia. I did start talking about it because it is a topic that everyone is really wondering about what it is. Is it a disease, and why it is so painful? While all investigations are normal. Today here I am in my theater list, and it's now during the break time, so I'm going to give you a quick talk about fibro. So of course, when it is widespread body pain more than 3 months, it's a chronic pain, as we mentioned. Why fibromyalgia is hurting so much? Important question. It's actually because there is hypersensitivity of the nerves at the peripheral nerves and also in the central nervous system, which is the brain. The problem here is there will be a pain memory formed in the brain, and because of that, it is very hard for the brain to forget that you have had this pain for so long. So what will happen? How is the mechanism? It works very simple. So when you have pain in a certain area, which is usually the chest, the arms, the legs, or whatever, in fibromyalgia, you will have increased substance P and different materials around the nerves that cause irritation and inflammation of the nerves and inflammation of the muscle. And this will send the signal through the spinal cord through something called ascending spinothalamic tract. I will try to make it simple as much as possible. It goes to the brain, and when it goes to the brain actually is going to send something called a stimulating signal, because the brain will be thinking there is a harm affecting that muscle or joint or area of the body that the pain is coming from. So the brain is always job is to protect you from any harm. When these signals coming all the time 24/7 to the brain is going to think there is a harm or issue. So the brain will send two things. One of them is called inhibitory neuromodulation signal, and one is a stimulatory neuromodulation signal. The inhibitory one is something to calm down the pain and irritation, but because you have this pain for so long and the inflammation is too much, the inhibitory neurotransmitters and modulation of the brain to try to calm down the pain, it doesn't work. So the other one only is working, which is the stimulatory neurotransmission from the brain to the area that has the pain. And what is the role of this? When this reaches the muscle or the joint or the chest or the tummy or anywhere, it's going actually to cause more muscle spasm in the area. So you started with muscle spasm, irritated the spinal cord, going to the brain, and then the brain is sending another stimulation going down again to the muscle to cause a spasm. And what will happen then? The muscle is in spasm now, so she's going to send a pain signal through the spinal cord again, going to the brain again, and the vicious circle keep going up and down all the time. And plus that, the brain will start to have a brain memory, and this memory is like the hard disk of the computer, never forget about the pain problems. And this stimulates more muscles and more nerves, and more pain is coming through. So, is there a treatment for fibromyalgia? Yes, there is a treatment, but it is in the form of pain management and not complete cure for fibromyalgia. Lidocaine infusion is one of the major things we use for management of fibromyalgia or any kind of very difficult pain. And I'm very proud to say that I have a biggest number maybe of pain patients who are on lidocaine infusion here in Afidia, in my clinic in Tala, and they have very good results. Lidocaine, what is the job? It's actually going to calm down the nerves. It's a local anesthetic. It's infused in the vein in the blood, go to the brain, the spinal cord, to the muscle, to the peripheral nerve, back to the muscle, and it calms down the pain stimulation and the pain memory and the stimulation of the nerves. So, is lidocaine only one session? No. Lidocaine I usually give a course of 6 sessions of lidocaine. According to the time frame planned, and I add some customized treatment to each patient. It could be medication, could be injection, it depends on what is the problem. And lidocaine infusion actually is proven to be very good. It is actually being offered in UK in NHS, but unfortunately in Ireland it's not offered. It's very rarely to find lidocaine infusion sessions available. So if you have any query, please email me. It's the email of Dr. Mubarak at paintreatment.ie. You can look also at my website, and it is www.drmonamubarak.com. If you have any question, you can WhatsApp, you can email, you can send on Messenger, anything, and I will get back to you. Thank you very much, and please follow up me, because in the future I'm going to speak more about fibromyalgia and more about the role of plasma-rich platelets in fibromyalgia treatment. See you and goodbye.